Welcome home to Beacon Hall. Beacon Hall is located in North Campus in the Village, our newest residential community. This residence hall offers mostly double rooms with both traditional and suite style options. A limited number of single rooms are available. Residents living in traditional style rooms will share a room with their roommate and a bathroom with their floor mates. Many community bathrooms are available on each floor for residents living in traditional style rooms. Bathrooms are cleaned daily and offer spa-style sliding doors for privacy. Residents living in a suite-style room will share a room and a private bathroom with their roommate. Suite-style bathrooms are cleaned weekly with a sink that is located outside the bathroom for added convenience. Every room comes furnished with a bed, desk, chair, and dresser. A large window in each room lets you enjoy plenty of natural light. There are kitchen areas on each floor with a microwave and sink for convenient cooking and cleanup. Each building in the Village has a unique ground floor lobby with common areas and a full kitchen that includes a stainless steel fridge, oven, stovetop, and sink. Need groceries? Head to the on-campus Publix, only a short walk away. When you don't feel like cooking, the Hub is right next door. At this dining hall, there are a wide variety of options that change daily, from a burger and fries to vegetarian stir-fry. You can also visit the nearby housing service desk at Hall EM, where you can go if you have any issues with your keys. You'll also find a printer here that all students can access. Grab a coffee between classes from the Starbucks just a short walk away. You can order ahead to skip the line or visit the walk-up window for speedy service. You'll find a wellness and recreation center at the Fit, where you can also lounge and enjoy our beautiful Florida weather in a zero-entry resort-style pool. When it's time to do your laundry, you can visit the laundry room on the first floor. Use quarters or swipe your USF ID to pay with Bullbucks. It's up to you. To learn more about our housing options, visit usf.edu/housing. Get ready to live the Bulls life.
Coming to you from the beautiful University of South Florida campus in Tampa, it's USF Housing Live!
Welcome everyone. This is USF Housing Live. I'm your host, Julia O'Hara with Housing and Residential Education at the beautiful University of South Florida in Tampa. Housing and Residential Education is here to answer your questions as you prepare for college. If you're joining us live, type your questions in the comments and we will answer you in real time. In tonight's episode, we'll be speaking with leadership from USF Student Health Services and the Counseling Center. But before we get started, we have a few announcements to share with you. The room self-selection and room change process remains available until June 30th. Additional bed spaces will be released this Friday at 4 p.m. Eastern, including suite and apartment-style rooms. The room selection self-service tool can be accessed through the housing portal linked on our website at usf.edu/housing. Now let's welcome our first guest this evening, the Executive and Medical Director of USF Student Health Services, Dr. Joseph Puccio. Hi, Dr. Puccio, how are you? Thank you so much for taking the time to chat with us. I know you're very busy, so making time in your schedule really means a lot to us.
It's a pleasure to be here tonight.
Great. Well, let's get started with some questions. Can you start off by telling us who you are and what you do here at USF?
As you mentioned, my name is Dr. Joseph Puccio. I am the Executive and Medical Director of Student Health Services. And what that means is that not only do I provide clinical care on all three of our campuses, but I also oversee the functioning of both the clinical and the administrative aspects of student health services. And I also provide supervision for the compliance areas, like the immunization compliance as well as insurance compliance.
And talking about student health services, can you tell us what kind of services are offered through SHS?
We offer quite a variety of services. We do offer primary care. That is our main service that we do provide on all three of our campuses. And our primary care services is what you usually go to your pediatrician for. If you're sick, if you need a physical, if there's something else that comes up that you wanted to speak to a doctor, that's our primary care services. But we also offer a whole host of specialty services. We do offer a travel clinic. So if you're going to partake in education abroad, you could come to our travel clinic. We also provide athletic training, psychiatric services, dietary services, as well as our immunization clinic.
And when using any of these services, can students use their private health insurance at Student Health Services?
Yes, they can. In general, to come to Student Health Services, you don't need insurance just to see a provider. The insurance does come in handy if you have to have blood work or any kind of specialty services like a rapid strep. We could charge those to your insurance. If you don't have insurance, we do still charge those, but those are significantly reduced rates than what you would find in the community.
Great. So my next question was going to be about options for students without health insurance. So it sounds like if you don't have health insurance, the best idea is to get any work that needs to be done at Student Health Services because of the reduced rate.
Yes, that's correct. We do encourage people, like if you're concerned about any kind of medical issue, at least you are always entitled to come see a primary care provider. They can evaluate you, they can guide you, and they can give you the various treatment options. And then you can decide what works best for you as far as if you have the money to do the test or if there are other options for you. We do have some specialty services that does have a copay anywhere between $10 and $20. Again, significantly cheaper than what you would find in the community.
Great. And if a student needs to fill a prescription, what is the process with Student Health Services to do that?
So if they're seeing a provider at Student Health Services, we do have an electronic health record called Epic. And through Epic, we can send an electronic prescription to our pharmacy that we have on campus. The pharmacy is called Bulls Country Pharmacy, and it's located in the Marshall Student Union. If for any reason that you need a prescription sent to another pharmacy, we can also do that. But we do encourage people to use Bulls Country Pharmacy because they really can get any prescription that you need at a pretty significantly reduced rate. So even if you don't have insurance, Bulls Country Pharmacy can help you with the price of a prescription.
Great. And moving to vaccinations, what are the vaccinations that Student Health Services offers?
So we offer pretty much any vaccine that's out there. We offer all of the pretty common ones like measles, mumps, rubella, a tetanus shot. We offer flu shots, and we also offer some special vaccines such as the meningitis vaccine, as well as any vaccines that you may need if you're doing traveling abroad, like yellow fever or any of the salmonella, any of those type of vaccines.
And speaking of vaccines, moving into talking about COVID-19, what precautions does Student Health Services recommend students take to mitigate the spread of COVID-19?
So we are really strongly recommending a bunch of things. The basics, such as hand washing, that is always key. And that is good. That is just a good practice for to prevent any type of medical illness, the flu, strep throat, any of that. Washing your hands constantly between throughout the day, just making sure. And if you don't have soap and water available, hand sanitizer is also a good way to do it. We do also strongly recommend that people get vaccinated for the COVID vaccine. We recommended any of the 3 FDA-approved vaccines, either the Pfizer vaccine, the Moderna vaccine, or the Janssen vaccine. At USF, we do offer both the Pfizer and the Janssen vaccine over on the Tampa campus and the St. Petersburg campus. And on the Sarasota campus, we're offering the Moderna and the Janssen vaccine. In addition to that, we do strongly recommend that people wear masks. Even though it's recommended, it is not mandated on our campus. We strongly do recommend, particularly if you're in a setting where there is a lot of people in close surroundings, we do recommend that you use your mask because it is a very effective tool, not only for COVID, but it's also very effective to prevent the flu. So if you know you're going to be in tight corners, I strongly recommend you using a mask, even if you're vaccinated.
Great, thank you for that, Dr. Puccio. We're getting some questions from viewers, so thanks everyone for watching and sending in your questions. Lori is asking, and we covered this, so just recapping, is there medical services available for students living in dorms without insurance? So just to reiterate, are all services at Student Health Services available to residents, even without insurance, and then they're just billed a reduced rate?
Yes, so students can come see any of our services, whether they have insurance or not. If they have insurance, we'll go through their insurance. If they don't have an insurance, they could still use our services. The primary care services, they will not be charged anything additional. But for our specialty services, they will be charged a copay anywhere between $10 to $20.
And Lori has some follow-up questions to that, including how do you make an appointment with Student Health Services, which was going to be one of my questions later, so we can go over that now.
So we, since the start of COVID, we had to change the way we schedule patients for appointments. We are really going to be emphasizing this semester, both the summer and the fall semesters, that you call in advance for an appointment. This way, you'll be able to get your appointment scheduled promptly, and you also won't be going through waiting for someone to come out to you, to talk to you, to find out why you need an appointment. That all can be taken care of on the phone. There's also a link on our website that if you don't want to talk on the phone, you could actually click on a link that you'll be able to fill out, and that will go to our scheduling center, and they will reach out to you to schedule an appointment. We also will, if you do come up to Student Health, you will be encouraged to call the call center. So I do have to strongly recommend to call the call center. The number is 813-974-2331, and you'll see it all advertised all over campus and on our webpage. So if you want to schedule that appointment, call the call center.
Great, thank you. And is dental or psychology appointments available through Student Health Services?
So dental services, unfortunately, are not. We do provide, the medical providers can provide you with various different options for dental services, but we do not provide dental services on our campus. As far as psychology, the psychological services is cared for through the Counseling Center. However, in Student Health Services, we do provide psychiatric care. And the difference between the two is the psychiatrists are the ones that evaluate you for mental health concerns, and they'll write a prescription. The Counseling Center offers talk therapy.
Great, and we're going to be talking with Dr. Strader from the Counseling Center following this interview. So if you're watching now and you have more questions about the Counseling Center at USF and the different resources that are available through it, be sure that you stay tuned. A viewer is also asking, which might be a question that I ask Dr. Strader, and I can wait to ask him if this is better for him, but does USF offer body image therapy on campus?
So we do provide counseling for body image. We also do it for body dysmorphia, as well as any type of reflective issues or concerns.
Great, thank you. And we can maybe talk about that a little bit later too, if there's any follow-up questions to that with Dr. Strader.
Yeah, Dr. Strader will also be able to talk about the different modalities they use to treat that.
Great, thank you. And this question is for housing, so I'm just going to take a quick minute to answer this. Lori is asking if a student needs to bring a mini fridge or a microwave. It's not a requirement to bring either of those things into your residence hall, but you are able to do that. We recommend that you talk to your roommate if you are going to be sharing a room with someone, just to make sure that you're not bringing the same thing, because you probably don't need 2 microwaves or 2 mini fridges. And then there is a maximum wattage and square footage to those for the microwave and the mini fridge. So we can drop that in the comments to make sure that you get a list of things that are permitted in the residence halls. And now back to my questions that I have planned for you, Dr. Puccio. We were talking about the mitigation of the spread of COVID-19, and you shared some great tips. Can we talk about testing for COVID-19? I just want to take a moment to give a huge shout out to you and your team in the past over a year during the pandemic, the amazing work that you've all done with testing and then the isolation process. You all worked tirelessly through that. So we really appreciate your efforts. What does testing right now look like if someone does want to get tested for COVID-19 through Student Health Services?
So first of all, thank you for your very kind words. Currently at Student Health Services, we have no issues or difficulties scheduling a test. We do PCR tests, and we also do antigen tests. The best thing to do if you want to get tested is, again, to call our call center and say that you would like to be tested for COVID-19, and they will schedule you for a test. It could be the same day, or it could be scheduled out a couple of days. We do our scheduling close to our clinical building. It's located at the Student Health Center Annex, and you will see it is done outside. We have staff members that are located outside that would be ready to test you there. And all of your test results will be reported through our patient portal called MyChart. And when you call to schedule an appointment, you could ask our call center representatives to have you sign up for MyChart.
Perfect. Thank you. And let's shift gears to talk about Summer B Move-In, which we know is in a couple of days. Friday, we have our students arriving for Summer B. So we are going to be doing a health screening that your team is going to be leading when you arrive to move in. Can you go through that briefly of what students should expect on Friday, and if they should expect the same thing for fall?
Sure. On this coming Friday, we are going to be doing a health screening. This year, we're doing things a little different than the move-in last year because things have changed quite a bit. A lot of people's risk factors for contracting COVID-19 have changed over the last couple of months, either by being infected, by being vaccinated. So what we are going to be doing is when you come to check in, the first area that you're going to encounter are the representatives from Student Health Services. And they're going to be presenting you with a questionnaire. They're going to be some 4 very short questions, and they're going to be looking at whether you've traveled, whether you have any symptoms of COVID-19. Have you ever contracted COVID-19 in the past 12 weeks? And if you've been vaccinated. And based on the information there, we'll be evaluating your risk for contracting COVID-19 and determining if testing you before moving in is appropriate or not. And then we would be able to have you schedule a testing appointment, and then we would be able to have you move on. On the Tampa campus, we will not be testing the same day. We will be scheduling you for a few days out for your test if you need to get one, but it's not going to stop you from moving in on the day of move-in.
Great. So that's a big change from if you did move in the spring or the fall, where you would be taking a test there on site. This is just a screening to see if that step is necessary. So, and do you know, I don't know if we've had these conversations yet because I know so much can change between now and August, but is the plan to do that for the fall as well, a screening similar?
So we're following CDC guidelines very closely. Things have changed very rapidly, and between now and August, recommendations may change. At this point, our plan is to do something similar to what we're doing for Summer B. We may have to make changes due to the scale of the number of people moving in, but the plan is right now that we would be doing something very, very similar to this. And again, like I said, if anything changes from the CDC, we would make those changes and we would communicate them to you. We will communicate what our plan is a couple of weeks before move-in through a email communication directly from me.
Great, thank you. And then we have a question from Angela, who's watching, asking about the water fountains and water bottle fill stations in the halls, if those are going to be reopened. And to my understanding, the Dr. Corral, the USF president, has announced that we're going back to pre-COVID operations on campus, which would mean that those would open back up for use starting this Friday, which would be the beginning of Summer B.
Julia, if I could add one thing to that, any of the medical services on the USF campus is an exception to that. So when you come to Student Health Services, you will be required to wear a mask, and our water fountains are not for use at our services, as well as we do not have patients waiting in the actual building. We will keep patients outside until they're ready to be roomed. We have changed our clinical services that as a patient checks in, they will be brought directly to an examination room. They will not be waiting in waiting areas.
Thank you for bringing that up, Dr. Puccio. That's very important to note with that announcement that is an exception. And Vava, who's watching, is asking if students will be required to take the COVID-19 vaccine to live on campus.
So as of this point right now, there is no COVID vaccine mandate to live on campus. It is recommended, we strongly recommend it, but it is not mandated for you to get the vaccine to live on campus or to attend a university.
And Gia is asking about what I'm assuming to be the Summer B. We'll talk about Summer B health screening because that's what we have planned for on Friday. Will the screening be the same for St. Pete? And do you need to show proof of vaccination when you are giving that information during the screening?
So if you want to give us the information for your vaccine, yes, we would accept that information. We don't demand it of you. It's not mandated that you present that to us. But if you would like us to have that information, that helps us do a risk stratification for you so that we can help guide you in what is the best next steps for you. And to avoid any unnecessary testing. So if you're vaccinated, you want to give us that information, we'll be able to take that into consideration, whether you need to be tested or not. The St. Pete is pretty much the same setup as what we're doing in Tampa. There's a few small changes because of the differences on their campus, but for the most part, the screening is exactly the same. And I am also supervising that screening, so if there's any issues or concerns, the staff there will be contacting me to consult.
Great. And the follow-up question Gia has to the testing process, if you go through the screening and it's determined that you need to take the test, what happens if you do test positive?
So if you do test positive, you will have to follow the CDC guidelines and you will have to isolate. If you do test positive there, we will be able to provide isolation on campus if you do test positive.
Great, thank you. And what we'll do is go ahead in the comments, drop a link to isolation frequently asked questions in case anyone has any specific questions about the isolation process.
One thing, if I could add about the screening process, one thing that we often require is that if anybody's been infected in the last 12 weeks, so if taking Summer B move-in into consideration, so if anyone has tested positive since April 9th, if you could please bring the paperwork for that positive diagnosis, because if you have tested positive since April 9th, we will not test you during that time period because there's a likelihood that you would still test positive.
Got it. All right. We've gotten through all of the questions from the audience about student health services. So my last question for you tonight is, what new initiatives is Student Health Services taking for the upcoming year? What do we have to look forward to?
So there's two major things that I think would be of interest to students. We are going to actually continue telehealth, which is a great service for students that may not be feeling well and they want to get seen by a provider, but they don't want to come on campus. You can call Student Health and schedule a telehealth appointment with one of our medical providers, and that's been a new service that has been rolled out in this past year, and we're going to continue it into our new clinical model, which will allow for patients to choose between in-house appointments or in-person appointments and telehealth, which is exciting. We also will be introducing something called e-check-in, which means that you actually could check in on your way to the clinic. You don't actually have to be at the clinic to check in. So when you call to schedule your appointments, the representatives will be telling you about e-check-in. But probably the most important thing that we are working on, we will not be able to offer much this year, but the exciting thing is that 2 weeks ago, we actually broke ground on a new building that will house Student Health Services that will be opening next fall in the fall of 2022. But it'll be very exciting to watch the building rise from the ground, so that you'll be able to see what our new building will look like, and be looking forward to welcoming everybody to those services when the building opens in the fall of 22.
Great, that's awesome. Thank you for sharing that. Well, Dr. Puccio, thank you so much for taking the time to answer all of our questions and for all you do, and have a great night.
Thank you so much. It's a pleasure being here, and thank you for inviting me.
Absolutely. Have a good one.
You too.
Well, it's time for us to take a short break, but don't go anywhere. We'll be back with more USF Housing Live right after this.
Welcome home to Juniper Hall. Located on South Campus, Juniper Poplar Hall, or JPH, is a beautiful residential community designed to give you everything you need to succeed. Juniper Hall is connected to Poplar Hall by the common lobby on the first floor. Juniper Hall offers suite-style rooms. Each suite consists of 2 double occupancy rooms that share a bathroom, which is cleaned weekly. Each bedroom has its own sink outside the bathroom. Every bedroom has a bed, dresser, chair, and desk for every student, as well as a shared closet space and a window. You can maximize your space by requesting to have your bed raised up to 5 feet high. This way, your desk and your dresser can fit underneath. Each floor has a full kitchen with plenty of counter space to cook your favorite meals. When you don't feel like cooking, you have easy access to a dining hall, Juniper Dining, right on the first floor. Here, you can find a wide variety of options that meet different dietary preferences and needs. Across from Juniper Dining is the first floor service desk, where you can go if you have an issue with your key or have a package ready for pickup. This is also where you can find your mailbox, as well as a printer that all students can access. When it's time to do your laundry, visit the laundry room, also on the first floor. You can use quarters or swipe your USF ID to pay with Bullbucks. It's up to you. Need groceries? A quick snack? Drop by the Pod Market just outside, where you can find all of your favorite snacks to fuel your study sessions. Have some downtime? Grab your sunscreen and take a walk or a jog around our beautiful campus. Or reserve a spot to study at the library just a short walk away. To learn more about our housing options, visit usf.edu/housing and get ready to live the Bulls life.
Welcome back. I'm Julia O'Hara, and if you're just now joining us, this is USF Housing Live, and we're here to help prepare you to live the Bulls life at USF. Ask us your questions in the comments, and we will answer you live on the show. Our second guest this evening is the director of the Counseling Center at USF, Dr. Scott Strader. Hi, Dr. Strader. How are you tonight?
I'm great, Julia. Thanks so much. It's good to see you again.
Yeah, good to see you too, and thanks for joining us virtually tonight and taking the time. We have some questions for you here that we'll jump into, and if anyone's watching and has any questions about the Counseling Center and the services offered, please drop them in the comments, and I will ask Dr. Strader on your strader. So to get started, can you tell us a little bit more about who you are and what you do at USF?
Sure. I'm Scott Strader. I'm director of the Counseling Center on the Tampa campus of USF. So I direct all of the mental health services, the counseling services that are provided through that campus.
And where is the Counseling Center?
Yeah, so let me start out, Julia, by saying that counseling services are available for students on any campus. So we have different centers on each of the campuses. As I mentioned, I direct the services on the Tampa campus, but there are also services on the St. Pete campus at the St. Pete Wellness Center, and also on the Sarasota-Manatee campus through New College of Florida. They direct the mental health services down there at Sarasota-Manatee. On the Tampa campus, the main counseling center is located in the Student Services Building. It's abbreviated as SVC on the USF maps, but it's pretty much in the heart of campus, the center of campus. It's the same building and complex where career services and financial aid and the registrar's office, that same complex of buildings there in the middle of campus. So pretty conveniently located for students.
And are appointments in person right now, or are they still virtual?
So yes, we've been providing virtual services since the beginning of the pandemic now for about 15, 16 months. And those telehealth services will continue to be provided. I heard Dr. Puccio talk a little bit about telehealth through SHS, and we're going to be providing telehealth services as well. However, starting with Summer B, we are going to be inviting students into in-person services with our counselors. And so we'll be giving students a choice with the beginning of Summer B and into the fall. Now, that'll be for our individual services. All of our group services are going to continue to be offered through telehealth. So that will continue to be an offering that will be virtual. But walk-in appointments as well as individual appointments in the counseling center, students will be given a choice in many cases to have those services in person or via telehealth.
And you talk about the services, and I know there's a lot of services and resources that the Counseling Center provides. On all campuses, what are the different services that are provided?
Yeah, sure. So most of what we do on all three of the campuses is individual counseling. So that gives meet with a counselor individually for no set number of sessions, but for a number of sessions that may be useful to you. We also provide group services. Group counseling services are offered on all three of our campuses as well. So that's a primary service that we provide. We also do a lot of outreach and consultation with different community groups on campus. So you can invite one of our counselors to the student group meeting to talk on issues of mental health that may be of interest to college students. And we do that on all three of our campuses as well. But really, when you think about the services that we provide, it's really individual counseling, group counseling, and outreach and consultation services.
And if a student is interested in making an appointment to see a counselor, how do they go about doing that?
Yeah, I think what I would first recommend is that you visit our website, and you can find that just by Googling USF Counseling Center, or head into your search engine, and that'll take you to the main Counseling Center website, and then you can find each of the counseling centers, the three campuses there. Or you can just, in your search engine, say USF Counseling Center at the St. Pete campus or something like that to get directly there as well. So that's, I think, where I would direct students first. You can always give us a call. And on the Tampa campus, that number is 813-974-2831. We'll be happy to talk you through the process. But check us out online because there is some paperwork there first before calling us to get an appointment. And that way, that'll streamline the process a little bit. It'll give us a little bit of information about you and what your interest might be and why you might want to see a counselor. And that'll give us just an insight when you call to schedule that appointment. So that's really the easiest way on all three of our campuses to reach us is just to pick up the phone and give us a call. We certainly respond to email and inquiries through the website, but I think giving us a call is probably the easiest way to do that. Now, we offer services primarily from 8 a.m. to 5 p.m. Although as we move into the fall semester, there will be some evening appointments after 5 o'clock available via telehealth. But the services in our office will be available through Friday 8 to 5. And students can get in as well. Our doors are open. They've been open, and you can walk in and talk to our desk staff and find out our services there too. If you feel like you're in immediate need of to see a counselor and don't really feel like you can simply walk in as well and talk to you about the options to see a counselor more immediately as well. You can certainly make an appointment and set it up on your schedule, and that'll give you an opportunity.
Great, thank you. Thanks for all that information. And I just want to take a quick moment. The microphone to your computer that is receiving your audio, is there anything covering it or is it not plugged in all the way? I just got a notice that it could potentially be cutting in and out. That's okay. We'll move forward with it because it's still understandable, but I just wanted to see if there was anything we can do. We're living in this age still. We're trying to do things virtually and seamless for the most part, but there's always something. So
always. Okay, I'll do my best.
Okay, thank you. Thanks for that.
Sure.
Thanks for checking. So when it comes to seeing a counselor, are there any costs associated?
Yeah, so all of the services we provide on all of the campuses are free of charge. So all of that is covered under a fee that students pay that's associated with tuition, so there are no additional charges there.
Awesome. What a great resource for students. And so it's free of charge, and it's a great thing to do if you're needing to talk to someone about anything. So what are some of the benefits that do come with speaking to a counselor?
Yeah, and there are many, certainly. And what I really like to tell students and talk to students about is that there really isn't any problem too small or too large to come to us with. So if you're feeling like you can be better in terms of how you're performing academically, maybe how you're performing in terms of your social relationships, and you want to improve the quality of your relationships, whether that be with friends or with a romantic partner, or even with your parents and family, those are always good issues to be thinking about, and issues that you can work on, concerns that you can counsel. So I would say that anything that's going to help you to be a better student, to be a better friend, to be a better partner, certainly issues that are certainly relevant to us and that we see every day. So certainly the most common concerns that we see that are related to that certainly have to do with anxiety, whether that be academic anxiety or social anxiety, or concerns about just being able to be the best person that you can be. Depression is certainly a very common concern we see with students. Those are really the top two, but really as we check off down the list, you can imagine that those two topics certainly affect many different things in the way that we operate on a day-to-day basis with our classmates, with our professors, with roommates, with the people that we interact with. And so as you begin thinking about how you're navigating college life, and certainly as you come up against these issues, any of those concerns can be things that can really benefit you to be better at what you want to be able to do and what you want to be.
Absolutely. And coming out of this past year and a half with the pandemic, I'm sure that you see a lot of people with anxiety and apprehension about returning to not only social settings, but to campus life. So what are some resources that the Counseling Center plans to offer for students that are experiencing that?
Yeah, sure. That's on our minds a lot, as you might imagine. We are coming back to campus as counselors on a more regular basis and returning to our own kind of pre-COVID operations. We're feeling those same kinds of things and wondering how it's all going to go and wondering how it's all going to roll out as we return to a very full campus. We expect to be a very full campus. And so we've developed, most immediately here in the summer, we've developed a workshop that students can join us for that really focuses on some of the skills and things that you can be working to develop, that students can be working to develop to feel more comfortable returning to campus, to manage whatever anxieties that you may have about doing that. And it's very much focused on giving students an opportunity to talk about what they've experienced over the course of the pandemic, what their concerns might be, some strategies and skills, very skills-based, to help manage all of that as you move forward. And so we're real excited about that. It's a two-part workshop, and all of that information, again, is on our website. And in fact, this is one of our drop-in services that you don't even have to call us in advance to drop into. Just check out the information on our website, and when it's offered, and show up at the time. It's all going to be virtual online, so you can find the link there on our website and just check it out. You don't have to attend both of the series, but I think it's going to be helpful for students as they begin to think about navigating the journey back to campus. It's going to be like. I'll also say that as we begin thinking about moving into the fall, as I mentioned earlier, offering both in-person services as well as telehealth ongoing services. One thing students might be thinking about is how to negotiate that as well, even in terms of the counseling center. And one thing that we've been doing over the course of the pandemic that we'll continue to do as we continue to offer telehealth is recognizing that students may want to telehealth, but may not feel completely comfortable coming into the center and sitting in a room with someone for an extended period of time with the door closed. But they want to engage in services and they want to do that in a telehealth kind of setting, but they may not have a real private space to do that, either in their home or in the residence hall or wherever they might be over the summer. And so we do have some spaces available on campus that students can kind of drop into, use to conduct a telehealth appointment with us. So it's a way to have a private residential space outside the residence hall, but also be able to conduct that session via telehealth, also keep us distance. So those are just a couple of things, a lot of things that we're focused on in terms of thinking about reopening. We're going to serve students both at the counseling center as well as via telehealth services. And those are just a couple of things that are certainly top of.
Awesome. Thank you for all of that information. And we do have a question from a viewer asking about, and you might have heard us talk a little bit about this earlier in the show, about what kind of therapy or counseling is available for body image or eating disorder issues. Can you talk a little bit about what it would be offered to a student that's struggling with something like that?
Of course. And that is certainly a common issue. As I mentioned earlier, we talked a lot about how you can be your best academic self, how you can be your best social self, how you can be your best kind of individual self as well. So eating concerns and eating disorders are certainly things we are familiar with and see a fair amount of in our students. And of course, those eating concerns can take a wide range of presentations or consequences. And so we're real comfortable in terms of managing wherever students might be eating concerns or what might be happening for them. So the way to get started with that is, again, give us a call, get appointments set up with an individual counselor, have us really sit down with you and kind of walk through a set of questions, get to know you better, get to know where your concerns are. We have in the past offered, again, a drop-in kind of service for students who may be thinking about or considering eating concerns, how they're responding to their eating concerns. We have certainly have individual treatment available. As Dr. Puccio mentioned, we work very closely with eating concerns with Student Health Services. Student Health Services has a nutritionist services available, as well as psychiatry services available for students who are experiencing certainly eating concerns that are more concerning to them and more concerning to us. We will certainly take that team approach. We'll be able to offer nutritional services, psychiatric services, counseling services. And then we all work together in a really interdisciplinary team to ensure that we're really providing the best service to those students. And that's just one step along that journey that we can work with students around. So there are any number of avenues and options that we can take to students who might be experiencing eating concerns, from certainly individual counseling, drop-in education, that might be helpful to you all the way up to a more interdisciplinary team.
Absolutely. And, you talk about nutrition. I did want to take the opportunity to just plug our next episode, which is not next Wednesday, or we have a break week next Wednesday, but the Wednesday after, we are going to be talking all about dining, and we're going to have a nutritionist on the show to talk about the different options with people with dietary restrictions or potentially going through any of the struggles that we just mentioned. So definitely tune in for that if you're watching with us tonight. We have another question from a viewer asking if all of the counselors are licensed.
Well, very good question. Mm-hmm. Certainly a large component of what we do is the training program. So that helps us to be able to train counselors in training and individuals who are along their licensing journey. Certainly most of our counselors in the counseling center are licensed. We have about 24 licensed professional staff on site in the Tampa campus. And that's, again, what we have at the Tampa campus, and there are licensed professionals on each of the other campuses as well. And so there certainly are licensed professionals available. But we also provide supervision and training to psychologists and counselors in training. So we do have a number of unlicensed staff that are under supervision in our office as well. So there may be an opportunity to see one or both of those folks, depending on kind of what concerns are. Most of our counselors are licensed, but
Great. Well, thank you so much, Dr. Strader, for all of that information. That was the last question from the audience. related to the counseling center. We do have a question about, I just wanted to address really quick about move-in and the time slots for fall. I just wanted to let everyone watching know that we are going to have a lot of move-in information released on Friday, including information about those move-in slots for the fall and when they'll be. So if you're watching and you are planning on moving in this fall, just stay tuned and keep updated on our website, housing.usf.edu, because we will have more information released on Friday when we have everything finalized. So Dr. Strader, I want to thank you again for taking the time to join us this evening. We really appreciate having you on and you providing all of that valuable information.
My pleasure. It's great to join you, Julia. Thank you.
Thank you. Have a great night.
Thanks.
So if you have more questions about living on campus at USF, please email us at housing@usf.edu or call us at 813-974-0001. And be sure to join us for our next episode on Wednesday, July 7th at 7 p.m. Eastern, where we'll be talking all about dining on campus. You can watch on our Facebook or YouTube page, the USF Class of 2025 Facebook group, or the USF Parent and Family Engagement Facebook page. USF Housing Live is produced by Housing and Residential Education at the University of South Florida in Tampa. Our motto is best place to live, best place to work, and best place to learn. Thank you to tonight's guests for joining me this evening. Thank you to our production crew, to you, our viewers, and of course, there's always just one last thing. Go Bulls! Good night, everyone.